My name is Dr. Laura Hancock Jones, and I'm a family dentist at Union County Family Dental in Western Kentucky. And I'm also the chair of the Kentucky Oral Health Coalition. It is estimated that more than 50% of injuries due to child abuse are on the head and neck, meaning the warning signs of abuse are front and center for dental professionals. This group of health professionals have unique opportunities to ask important questions, provide key information, and observe both parents, caregivers, and children for the warning signs of child abuse and neglect. Maltreatment occurs in all ethnic, social, and economic groups. It can and does happen in every type of family. Bruises are the most commonly missed early warning signs of abuse, but they're also the most easily recognizable if you know what to watch for. When it comes to child abuse, it is very, very rare for a child to be seriously injured or killed the very first time they are abused. There tends to be an escalation of violence over time, and that's why it is so important for all of us who care for children to notice those early warning signs so that we can stop that violence before it escalates. The 10-4 Bruising Rule was developed to help us determine what kinds of bruises are worrisome for child maltreatment and what kinds of bruises are more typical. TEN stands for torso, ears, and neck. So any bruising of the torso, ears, or neck of a child 4 years of age or younger, or any bruising anywhere in a child that is not independently mobile, is very concerning and needs to be reported to Child Protective Services, or CPS. Here are examples of torso bruises. If you see injuries on torso, particularly bruising, that needs to be reported to CPS. Here are some additional examples of ear bruising. It is important to understand that ear bruises are very rare from accidental injury. If you see an ear bruise, it needs to be documented and reported. As you can see, ear bruises can involve multiple parts of the ear. Any kind of ear bruising is concerning. Here are two examples of neck bruises. The neck is a very vulnerable part of a child's body and very rarely injured accidentally. If you see injuries on the neck of a child, particularly bruising, that needs to be reported to CPS. The last part of the rule is about our most vulnerable population, our babies. Any bruising on any baby who is not yet independently mobile is highly concerning for inflicted injury. Bruising on babies is not normal. Bruising on babies needs to be taken very seriously. The rule of thumb is that those who don't cruise rarely bruise. And cruising is a developmental stage where children are pulling up on furniture and starting to take steps. In addition to the 10-4 Bruising Rule, it can also be helpful to understand what normal patterns of bruises are in young children. In general, children tend to get bruises on the front parts of their body over bony areas. Those tend to be the areas where there's skin right over the top of the bone, so the forehead, the elbows, knees, and shins. In addition to torso, ears, and neck bruising, other types of common pattern injuries in children who have been abused include stripe-like bruising on the side of the face, inflicted adult bite marks, and loop marks. Intraoral injuries can include torn frenula, soft palate, and pharyngeal injuries. Also, be aware of children with missing primary teeth. While this can happen accidentally, it's important to obtain a history from the child as well as the caregiver. There are multiple contributions to child maltreatment. Those include domestic violence, criminal history, substance abuse, undiagnosed and untreated mental health illness. But the one common thread that we see most is the adults having unrealistic expectations for the child's development. When it comes to talking with children, if the children are verbal and able to talk, it's okay to ask kids what happened to them if you see an injury. It's also important to let them know that you're there for them, that you care, and that they can talk to you. When it comes to reporting in the state of Kentucky, any person who has a reasonable suspicion that child maltreatment has occurred is required by law to report to CPS. When you do report, while you're allowed to do so anonymously, it really helps CPS if you give your name and occupation so that they can follow up and ask questions about the investigation. Photographs are really important. So when possible, help facilitate photographs being taken. You should be prepared to tell them the child's name, mother's name if possible, as all the cases are tracked by the mother's name. The father's name is helpful, but it's the mother's name that CPS uses to track cases. Also, be prepared to tell them the child's address, where they can find the child right now, and then the specifics, what you saw and what made you concerned that maltreatment was occurring. If you are very worried about a child and have concerns about the child's life being in danger, you need to say so when you call CPS, and it can also be helpful to give any information you might have about younger siblings in the home. As a recap, remember the 10-4 bruising rule and that bruising in babies is never normal. Bruises can't be dated, and photographs are very important to be able to assess injuries in children. We, as oral health professionals, play a critical role in recognizing and reporting suspected child abuse. Please join me in helping to keep kids in Kentucky safe. For more information and resources, please visit faceitmovement.org.